Well, I think, it's a big topic for men's health and hormone therapy for men. Fortunately, there are more providers becoming aware of the fact that hormone decline does happen in our 30s. I have a few guys in their late 20s. In the past, you would see your primary doctor, and it still does happen, and they'll say, "Oh, well, you're 400, you're in the normal range, you're fine." Well, there's a big difference between what we call normal and optimal. And as I tell patients, I don't do anything normal. Everything needs to be optimal. So your lab work will probably be abnormal for a specific age range because the goal is to set things where they were when you were in your 20s. There's not many sick 20-year-olds and not many walking around with erectile dysfunction or body composition changes, mood, all the things that we see. It starts to slowly sneak up on men. And as I said, with women's hormonal issues, they're so much more attuned into mood and feelings, and guys ignore all that. And so it's when the plumbing doesn't work that they wake up, or they're not getting the same results in the gym. I'm sore longer. My recovery time's not as well. Hey, I saw an ad on TV. Maybe I have low T. Well, maybe you do. And so, it's very important to be tested by someone knowledgeable in what to do about it, not someone that says, well, you're at 400, you're fine, you're in the normal range. No, well, you're in the 40th percentile if it goes to 1,000. And I always say, was that how you run your business? Well, no, of course not. I give it 100% or 110. Well, that's where we want you to be with everything. And so with younger men in their 30s and 40s, I never start with testosterone, which, surprises some people. But once you take testosterone, you will never make more because your pituitary stops sending, releasing hormones to the testicles because they see plenty of testosterone. There are also some potential associated fertility issues. And so I don't like to start with younger guys with testosterone. I use things to stimulate testosterone production. I use N-clomiphene from 3 days a week to daily, human chorionic gonadotropin, or HCG, a brand called Pregnil because it's the pregnancy hormone. But in men, it acts like luteinizing hormone from the pituitary and stimulates testosterone production. And I would say that at least 80% of the guys that I'd see and start on this protocol respond very well. There's sometimes a few that is just not going to work. And yes, we switch to testosterone, injections, pellet therapy, whatever the preference is for that person. But I like to try and do it physiologically. When we change that, it's dramatic. I mean, it's life changing. I have guys that have lost, well, one that lost 100 pounds, but, 20 pounds, 40 pounds, 50 pounds over the course of a year, having better muscle tone, better body composition, mood, strength, results at the gym, everything, and improvement in relationships. It's pretty exciting when that happens to have someone say, "Hey, you need to see my wife." I'm like, great. I love treating couples because when you have that magic in the relationship from a, strong sexual standpoint, that's why you married him in the first place. Everything worked. And when it stops and changes, it puts a tremendous amount of stress on interpersonal relationships. And sadly, it's overlooked by most physicians. They don't think of this first, and they should. And so, I'm leaving today to go to a seminar to work with my mentor, Dr. Rouzier. I'll be over in Salt Lake City for 3 days. I've gone through this particular course. This will be my third time. I'm going out of respect to him because I love the guy, and there's always something new, a new article. Here's more proof. Here's something that we learned. And I can then come back on Monday and relate that to my patients and the people that I care for. Not my opinion. I've never seen anyone fail unless they just, I saw a guy today. He's in Aspen, he's in Austin, Texas, back and forth. I last saw him in September. And I'm like, you haven't refilled that prescription. It should have run out in December. Well, I haven't been this and I haven't been doing that. And I'm just terrible. I'm lazy. I'm whatever. I'm like, well, how do you feel? He's like, well, I feel like I did when I first walked in here. I'm like, well, how about we get started again? He's like, I'm in. This I've been stupid. I need to I need to do this. I'm like, okay, great. And so it's easy. Within 2 weeks, 2 to 4 weeks, yeah, he'll be a different person. And so it's easily done. And when done correctly, I have never in 20 years seen anyone that didn't respond. Yeah, we do blood work. Initially, when I see men or women, I'll do what I call peak labs, just the hormones, somewhere from 4 to 6 weeks after we start. To make sure that we're on track and make adjustments to medications up or down. I'm pretty conservative and I don't like to give people too much too soon because they sometimes just don't feel well, particularly women. We give them too much estradiol after menopause and their breasts, feel like they're going to explode. They don't generally want to keep taking it. And so I like to go slowly, increase things into, again, what we consider optimal ranges where everyone was in their, early 20s. And after the first time or two, it's 4 to 6 week intervals. Then we do blood work every 3 months. Every quarter, we're looking to make sure, hey, your body changes. You're more active now. We need a little bit more, or your level doesn't need to be quite that high. I want your free testosterone to be in the 20s for men, and I want it to be between 2 and 4 for women. And that can be a drastic change in difference in dosing because of something called sex hormone binding globulin. There's a protein in your blood that actually, when that one's higher, it has cardiovascular benefits, but it also, the higher it is, it binds to more testosterone. So I might see a woman with a testosterone of 300, their family doctor's freaking out, but their free testosterone is 2.0. That's perfect. It should be between 2 and 4. And so it needs to be monitored. And then I educate patients as we go throughout the year or years so they know how to deal with providers that they're going to see that just aren't up to speed on all the things that we do. Fortunately, with things like my book, with other good books that are out there, there are some great trainings available to providers. And certainly there's tons of information on the internet and a lot of really good podcasts. Now there's not only doctors, but others out there like Dave Asprey and others that are proponents. Even Joe Rogan. I mean, everybody knows Joe Rogan, and he's an advocate of hormone replacement, doing the things that we do. I saw a clip a few days ago of RFK working out in a pair of blue jeans without a shirt in his 60s. He's ripped. Why? He has optimal testosterone and he works hard and he eats a high protein diet. That's what it takes. It's a pretty simple formula. You can't just take a testosterone shot and expect everything to change. I tell people you got to do your homework. You have to do your part with eating, with moderating alcohol, hopefully not smoking, but there are a lot of things that go into it. So give us a call. It's 970-201-1332, or go to our website, www.aspen-regenerativemedicine.com. Check out the podcast, Beyond the Fountain of Youth. Pick up a copy of my book. I go through A to Z, everything in my history of the last 20 years of what I've been doing, trying to help people. And I was patient number one. I wanted this to work for me. Some of my sports medicine buddies founded the American Academy of Anti-Aging and Regenerative Medicine, which I thought they were nuts in the beginning, and it's in my book, but they weren't. Dr. Bob Goldman was a trendsetter and a brilliant guy way ahead of his time. So just reach out to us, and we love doing this. And if we can't help you, we'll direct you to someone that can.